My name is Kyle Kingsley. I'm an emergency department physician from Minneapolis, Minnesota, and this is a presentation on the optimal use of medical scribes in the emergency department. There are many things to keep in mind when optimizing your use of scribes. We all have our idiosyncrasies, and it is vital that you pass these on to the scribe at some point. This is most important when you're dealing with a new scribe or a scribe who is not particularly familiar with you. In particular, history and exam findings are often very specific to a physician, and it's important that you pass on your preferences to the scribe before you start working together. All reputable scribe programs keep a running log of specific MD idiosyncrasies. It's also very important that you optimize templates to your practice. Describe what you are finding to the patient and the family while you examine the patient. This not only reassures the family, but it also gives additional information to the scribe. The scribe can then pick up on this and translate it into medicalese for the chart. This improves MD-patient communication and will save you time when you exit the patient's room. For example, statements such as, "Your lungs sound great on both sides," is not only reassuring to the patient, but will trigger the documentation of clear to auscultation bilaterally by the scribe. Another helpful statement would be, "Yes, we call that sound stridor at rest." This not only explains the situation to the parent, but triggers the documentation of stridor at rest in the respiratory part of the child's exam by the scribe. In detail description of the plan to the family will also give additional information to the scribe. A synopsis of the likely emergency department course is also quite helpful. This again improves patient-family satisfaction and will improve the scribe's notes. A very important point when using scribes is to try to utilize downtime. Walking between the rooms is a great time to explain specific physical exam findings or other information that you wanted included in the patient's charts. It's important that you use your downtime as a physician, if you have any, to pass on additional information to the scribes. Patient updates are often included in the notes by scribes. However, it is important that you as a physician pass on additional information as needed to the scribe in the setting. Well-trained scribes will also be aware of nursing updates and nursing notes. The use of customized templates is extremely helpful with scribes. Scribe EMR augmentation systems, such as those available through www.medmacros.com, are very valuable. This is the system used by my group. It is arguably the single greatest time saver for MDs. It allows scribes to start the medical decision-making for the physician based on the chief complaint, discharge diagnosis, and disposition. I also need to mention the integrity of the initial scribe program and training. Most quality scribe providers will guarantee this right off the bat. EMR, hospital, group, and MD-specific policies and adaptation should take place throughout implementation of the program and throughout the program itself. In parting, I want to emphasize that communication and increased back and forth with the scribe will lead to better notes. When in doubt, pass on information to the scribe and make them aware of your specific preferences. For more information on Scribe EMR augmentation systems, please visit www.medmacros.com. And for Scribe program consultation or startup, please visit www.clinicalscribes.com. Thank you for your time.